This is Vegas All-Net Radio, the final frontier of free speech.
Views and opinions expressed on this program are those of the hosts and guests and do not necessarily reflect those of Vegas All-Net Radio, its affiliates, or its parent company.
Good morning. You're listening to Good Medicine. I'm Holly Davis, CPCI, and with me today I've got a very special guest. This show is a long time coming because I have planned it in my head months ago, and it's finally coming to fruition. I'm so excited. This is something that's very dear to my heart. Is Dr. John Nixon. He is a CPC here in Las Vegas, in Nevada. He's a counselor, educator, and today our program is called Marveling at the Madness. What is it like to have psychosis? What is psychosis? Why is that important? Is it something that affects our listeners? Do they hear it, see it? Do they ever come in contact with it? And I'm here to tell you today, yes, every single day, on every corner, probably in every town. And this is not just in our nation now. This is not a pandemic that's happening in our nation. This is ancient, time-told stuff that is happening, that is happened throughout history. I know that I'm studying right now in human services. I'm working on my PhD, and we're doing a lot of studying of what happens with people who have psychosis and people who are different and people who look like life has kicked them around a bit. You know, when we see a dog like that on the corner, we stop and we go, oh my gosh, let me get you help. But this, with the people who are on the corner, who obviously you can tell that they're talking to themselves, they're very disheveled, they obviously haven't bathed themselves, they haven't been cared for, they don't care for themselves. And so historically, we as people, we've put them to the highest tower, we've put them at the edge of towns, we've ostracized them and we've alienated them. Why do you think that is, besides the obvious? Dr. Nixon, what do you think's going on?
Well, the problem with society is that they are very different in terms of their ability to communicate, in terms of their perception of reality, in terms of their ability to function in society. Therefore, civilizations across time have handled them in different ways, and they have functioned best in rural, small towns and villages where everyone knows that, you know, Sam is crazy and everyone kind of looks out for him. They get lost in the large urban areas, and one of the saddest things that for me when I was doing intake assessments at a behavioral hospital is when a person would come in who's severely mentally ill, and I would ask, well, who's the most supportive person or supportive people in your life? And they would say, my case manager. They don't have a human connection. And indeed, recent research has shown that having a human connection, having relationships, helps schizophrenics. That talk therapy, previously thought was not at all going to be useful, helps schizophrenics connect.
I think that's beautiful. I know that when I've worked in those situations, I know that their caseworker, I'm glad to hear that the caseworker makes an indelible impact in their lives because they've been heard, and then they feel like maybe someone's trying to help them. But the continuation of care and having the same caseworker, as you know, is seldom, rare to never.
Well, that's another issue because in the community mental health system, it's a high burnout, high turnover kind of a job. And in Las Vegas, we really do not have a system of community mental health.
Well, I was going to. That was my second question, and I want to add to that too. I don't see a lot of family members who stay the course too. I know that it's very difficult. So maybe we could speak to those people who may be even going through that now. And if you have a family member that you want to help, but you don't feel like you're able to, or that you're not equipped, believe me, there's times I don't feel equipped. Who is? You know, It is very difficult, but I think the more we understand and the more we know, then the less alienated and isolated we are to those people, because they're people. And I find that they don't have any friends or family pretty soon. They've burned every bridge, and I don't think it's anything that they've done purposely. But my deep burning question is, do you think that we've ever had a place for them? I know the rural areas sounds beautiful. We have a farm and long-term residential where they belong. I think that would be beautiful. But do you think through society, in any culture, that we've ever really treated them right or dealt with them properly?
A lot of cultures in the past, thousands of years ago, would see them in differential kinds of ways. They would see them as having a particular spiritual gift as having a direct communication with the divine, or they might be seen as demon-possessed. And so it's varied across culture and time.
That's interesting you mentioned that. The reason why we even call the program today Marveling at the Madness, because, they'd put them in pubs and drink and listen to their stories, and people would just marvel at some of the things that they would talk about. And I know for me, doing some of the casework and working with clients, I've noticed that to me, it is probably my favorite population to work with, because I've learned more from that population and all my clients than I know that I probably ever teach them or educate them. They've enlightened my life in many ways on a spiritual, mental level and emotional level as well. I've seen some of the best quotes that I will take with me to the grave have come from people with psychosis, and some of them were just so amazingly true and raw that I think people who, let's say, walk in normalcy may not ever have contact with that. And speaking of today, we're going to have a simulator today. Simulator. I always get that one messed up.
It's like nuclear and nuclear, which is not a word.
Okay, I don't know that one. But simulator is we're going to have something simulated so you can understand.
Yeah.
So you can have a similar understanding of what it is like to actually live with psychosis. Even for 5 seconds, you're going to understand.
Absolutely.
And I want you to please give me a definition. What is psychosis?
Well, psychosis means seeing or hearing and or smelling and or tasting things that are not there. It is a hallucinations, seeing things that aren't there. As such, it could be also illusions, a distortion of what you're seeing or hearing into something that it's not. It can also be, and usually is, delusional thoughts. The most common delusions are paranoid delusions, and they tend to be with schizophrenics very elaborate. It is that not just the government, but they have a whole scheme in their head of what the government is doing. So it's always an entity that is greater than themselves, that they can't control. Those are persecutory delusions, or commonly known as paranoid delusions, delusions of grandeur. I'm God's special messenger, that sort of thing.
They're going to take over the planet and become world leaders. And interesting. That is very interesting. But I also find clients that I don't know, is that typify psychosis? Let's just say you're working with another client who may be severely depressed.
Yes.
Who may even be bipolar and have emotions that are up and down, but they have some grandiose thought processes. Does that qualify as psychosis as well?
Yes, their psychosis does not necessarily mean schizophrenia. People can have bipolar disorder or depression, and with severe bipolar and depression, they can experience psychotic symptoms when they are at the peak of a manic episode or at the nadir of a depressive episode. Typically it is in hearing voices. It is hearing often, especially in depression, condemning voices. And one thing I've started to ask people is, well, those messages that you're hearing when you're really depressed, where have you heard those messages before in your life? And oftentimes that opens a door to emotional trauma, at the very least, that we can then explore in therapy.
So maybe the body is subconsciously storing all of these things.
Absolutely. One of the myths is that children, if they're young enough, will not remember whatever. In fact, we remember everything. It's simply that when we're prelingual, before we are able to speak, we don't have the language, and our brain is not developed to store those memories, to be able to express them verbally. However, those memories are stored in our bodies, and people who do body work are able to find spots that with the body work that's released, a flood of emotion comes that's usually connected to some trauma.
Well, I find that's very fascinating to me, because I know one of the first things that I remember learning, I know you're a counselor educator, is psychology is healing the soul. And that just stuck with me because I think even listening and caring for someone can heal their soul because they just have a voice and they're able to get things out or process things or fix things themselves that they had subconsciously packed away for so many years. But I think one of the bottom lines and one of the main messages why we do good medicine is because I want people to know if you think that you have been emotionally traumatized and you're a human.
Yes.
And you probably have.
Which, if you're listening to the show, you probably are a human.
Or your dog. If you get your dog along, too, I'm fine with that, too. I'm a big animal lover. But I really think that it's important that you've got to do some analysis. And I don't think that we're in the cultural milieu that we do that anymore, that we take that time to process life. Like, oh, when that happened when I was a kid, that really bummed me out. Or, for me, I remembered how I was taught how to swim. I was thrown in the pool and said, sink or swim. And that, thinking of that process with my girlfriends, I was like shocked. I'm like, I can't believe that happened to me. That was so traumatizing. I remember those feelings of trauma, and that's just good old-fashioned Southern style. Let's swim.
Well, that's right, or that's right, because as I might say, if I'm in the South, because we are social creatures, and even those of us who are introverts, which I am, we still need human connection. We need someone to bounce things off of because at the very earliest stages of childhood, in that critical time from birth to 2 years, is when our basic sense of self, our basic personality is forming. And so we need what's called the mirroring image of our mother, primary caretaker, in order to establish who we are. And so that bonding and that affection and that loving is affirming and kind of setting a pilot light, if you will, in our core, that we are then able, as we grow and as adults, to go into the world and know that we're okay.
Well, it's interesting, too, because last week we talked about parenting and how, I think sometimes we have a tendency to over-coddle, and especially if we're single parents or we're coming out of the ages of children are to be seen and not heard. Now we're really making sure that our children are well balanced with all the wonderful things and trying to be perfect parents, which I think is probably not possible. I think you can do as much as you can and love your kid. And I think, to me, the key of parenting is taking care of yourself and being the best that you can be, and then kids will be more healthier. Well,
that's right, because kids don't do what we tell them to do. They do what we do. I mean, wasn't that true for us as well? And so if parents are secure in who they are and have a stability in their life, that permeates to their kids, and because the kids experience stability, experience parents who aren't using their kids for their own emotional needs, for example.
Vampiring the children?
Vampiring the children. I'm going to use that term.
Yes,
like that.
Please do. Well, I think that we worry that we're going to ruin our kids. And I'm definitely saying that you can't ruin a kid. I think that I've seen some really bad parenting, but I believe in the human spirit and the resiliency. I know that my childhood was not perfect, and I don't use that to make any excuses in my life. I use that to make my life better and hopefully better other people's lives. I know that there's people who didn't have moms, dads, shoes for school. They didn't have shoes for school or a backpack or a brand new backpack every year. They got what they got.
But it's see, we often associate material things with providing, but the more important things are the emotional things. And I don't know. I'm a bit more jaundiced. Yes, you can ruin a kid, but it also depends on the individual's resilience and hardiness. And so, kids who have their basic personality, they come into the world. There's a vulnerability. There's a sensitivity. Then they're much more impressionable, and they're going to be more profoundly damaged emotionally, as opposed to the kid that sort of has an innate hardiness and resilience, like yourself, who's able to say, whatever happened, I'm moving forward now and I'm going full steam ahead. But most people don't have that.
It's interesting. I also believe, though, children do have rights. They're able to be educated. They should have a roof over their heads, and they should be provided for. And I also know that there's many stories, when you look at the human story, of children who didn't have that at all, or the nurturing, and they were neglected, abused, emotionally severely abused, and they, I know that there's a hardiness, but I also trying to believe but this is my own approach, my epistemology is that there's hope too. I
Sure.
always tell parents, especially parents who are trying to help their children who are very emotionally disturbed and even have psychosis. They ask me, is there any hope for my child? And I say, you know what, if they have hope, they have everything. There's always hope.
There is always hope, because we don't know how things will turn out. We don't know the positive seeds that are being planted, the corrective emotional experiences, and how they might take root and then help the person move past whatever is blocking them.
But I would definitely say, I'm a big proponent, like you are, that early detection, it's almost like cancer. If you know there's sickness and there's illness, and we know that there's many people who are not aware that there's some severe sickness and illness in the home. Being more aware, to me, I think, is the key. Looking, discovering.
Absolutely. The earlier that the intervention can begin, the better the prognosis.
Oh, absolutely. So there's always hope, and that's where teachers come along.
Yes.
Can help. Definitely the caseworkers, therapy. I know that there are also other organizations, and we're going to get some information out to our listeners as well. When we come back from our break, we're going to talk about, how does psychosis begin? Does it begin as a child? Is it children who are traumatized? Is there predisposition? What is going on? How does that happen? Could it happen to me? So those will be really interesting conversation coming up. Stay with us. This is Good Medicine. I'm Holly Davis. We're talking to Dr. John Nixon. You're going to want to stay. You're listening to Good Medicine. Good morning. You're listening to Good Medicine. I'm Holly Davis. I am a clinical professional counselor intern here in Las Vegas, and my number is 702-626-9400. And Dr. John Nixon is also a clinical professional counselor and a counselor educator. And today we're talking about psychosis, marveling at the madness. What do you think about that word crazy? Right? And I was thinking about using the music Crazy Train today, but I think it's used kind of flippantly. What do you think?
I think you should have played Crazy Train as a bumper.
Could we get Crazy Train, please?
Crazy covers a number of things, obviously, and psychosis is not the only thing that is covered by crazy, which is not a clinical term. But, yeah, I don't have much more to say about crazy.
I don't like it when my clients call themselves crazy, or they believe that they're crazy. And I know that children, a lot of times, I always reassure them, they say, they think that they might be crazy, and this might just be behavioral issues. It might not be a diagnosis. And I try to tend to discourage them from using that. However, the truth is that word has been used rampantly. Crazy.
Yes. And I mean, it is stigmatizing. And it is also used in a humorous vein as well, and where the line is between that and stigmatizing is not clear.
Well, I agree too, but I love in Crazy Train, if you'll listen to that song, Ozzy's talking about, love it. And is that not the best guitar ever?
It is.
It really is, Randy Rhoads. It's Randy Rhoads, right? Rest in peace. I think it is. If you listen to the song, listen to his heart in this song, He's talking about his own stuff.
Yeah, he really is. Since I'm ADD, I tend to lose the lyrics after about 15 seconds, but my mind wanders, but you're right.
But what's so interesting about that is that really, if you really look at it, we all have our own stuff that we battle.
Absolutely. In that sense, we do all have our own craziness, and we do have our own places, if you will, where we will just lose it for whatever reason.
It's interesting. And in this song, he's saying, does he say we forget how we learn how to love and forget how to hate? I think sometimes it is crazy how we walk around with our own. We all have our own, and I don't want to use the word demons, but we all have our own dark stuff. We have light, we're dark, we're young, we're old. We all have those things. And I think people who have psychosis, for me, in my experience, a lot of people have had extreme trauma and very young as well.
Yes.
Do you want to speak to that of the diagnosis?
Yes. In fact, recent research, again, has shown that a lot of people who have schizophrenia, who have psychotic disorders, have trauma. In their lives, trauma as a child, and it's never addressed in the system. Even states that have a good mental health system. They're treated with medication, but the thought that talk therapy wouldn't go anywhere. So they're carrying around all this trauma, and so really their crazy, if you will, was part of their own psychic sequestering of the trauma in order to survive psychologically, if that makes sense.
So basically their brain was kind of making up for the things that they'd experienced.
Yes.
So do you think if you're hearing things and seeing things, it's your brain's way to accommodate the trauma that you've experienced?
Yes. So let's say, for example, a child is molested or raped. The phenomenon of autoscopy, if you will, an out-of-body experience where it's as if their mind's eye is in a corner of the room looking down at their body as if it's somebody else. Their mind, their psyche is attempting to separate themselves from the trauma of the physical experience. And so having had that, then they may have a dissociative disorder and develop delusions and hallucinations later on in life, or it may just stay with that kind of dissociation so that whenever they encounter a high level of stress, they just kind of go numb.
They separate themselves.
They separate themselves.
Well, I don't think that's crazy because I think everybody does that.
Yeah.
We all flee and flail from pain. Nobody wants to experience pain, think about pain, so we numb out every day. I think escape is the biggest form of crazy, if you will. I think that some people have outer body experiences, and some people hear things, see things, or get paranoid, but I think other people, they listen to the television or the radio or the social media. They numb out as well because they don't want to face things that are going on in their own life. So I think that's pretty typical for humans to
It
avoid.
is, but it's a matter of the degree. It's on a continuum. So most people do not numb out to the degree of dissociation and sort of psychotic or near psychotic types of things, but the attempt to separate ourselves from stress and trauma, happens in that kind of way, where we will sort of separate ourselves. I was at the scene of a car accident a couple of decades ago, and one of the young women who came from the car that rolled over was, Where am I? What happened? Where are we going now? And just sort of completely oblivious to what just happened. That is a dissociation. Others in the car did not have that kind of dissociation. So that is what we try to do, is separate ourselves. And the other thing that we do is that we use vices, we use addictions, we use chemicals and processes, whether it is gambling or sex or porn or video gaming.
Shopping.
Or retail therapy to separate ourselves, or workaholism, to separate ourselves, from our lives and to sort of go into a zone where we really don't have to experience things to a full extent.
I say snap out of it.
Of course you do. Yes.
What do you think?
Get a grip therapy.
Get a grip therapy.
Get a grip.
Stop that. Do you think that works when you're working with clients who have psychosis and they're going on a tangent that is grandiose ideas and delusions and illusions? And do you ever just say, stop that? Could you ever call them on that? Or what's your approach? Depends on your approach, I guess.
It depends on your approach, and it varies depending on the person. You don't want them to escalate, so you don't want them to confront them too directly, because they will tend to escalate when you challenge that they're where they're at. But you try to bring a sense of calm, try to make them feel safe and secure where they are, and usually that will help to restore them to some level of being able to communicate. I was in a psychiatric a med review, on a medication on a patient who was schizophrenic, and you could see that she was starting to go into her thing. She was hearing voices because she was looking around the room and not listening to the psychiatrist. And he said, "Listen to me, don't listen to the voices. Listen to me, don't listen to the voices." So it kind of depends on. This was also in a hospital setting, so we were able to accommodate an escalation. So it depends on the situation, and depends on the setting.
That's interesting. I had a pretty similar situation with Dr. Junie. We're talking about Dr. Junie, and we're also going to give information to people who are out there who they should go to. Psychiatric would be the way to go if you felt
Yeah.
like.
A lot of primary care physicians, and this is especially true with the HMOs, with managed care, the primary care doctors are rewarded financially for not referring to specialists, which is why I will see a lot of patients who are being given psych meds by their primary care doctor and not being referred to a psychiatrist who is a specialist in this area.
Well, that's interesting because in research, I read that most primary doctors would say that they don't feel that they're equipped to do that.
Yes, but nonetheless, a lot of them still do.
I always say get a second opinion. Doesn't hurt to get a second
That's
opinion.
right.
I believe go to psychiatry. And Dr. Junie, I've worked with Dr. Junie, and when I was a little student kid where Dr. Junie was working, he gave me the best advice ever, and it really just set me free with clients who have psychosis and the patients at the time. And it was like, don't buy into the fear. Because pretty much I can tell you right now, if you have psychosis, if you're hearing things, seeing things, if you're feeling very paranoid, you're feeling isolated and you don't trust anyone and you're scared. And so if you get scared, you're not going to be able to help them in any way.
Right.
So he said, don't buy into the fear. And I'm just like, right. I'm not going to buy into the fear. That's great. And, ever since that time, I found that it really, truly is one of my favorite clients to work with.
It's not like we're going to catch something from them. Like, someone with lice or things that are in their hair
Can't
that can
catch
fly
crazy
onto
fever.
you, Yeah. You're not going to get bed bugs from them unless they have bed bugs. I mean, psychosis doesn't transmit that way. It doesn't really transmit.
Well, they're humans.
Yes.
They're human people. And I think some of the people that we see on the side of the road, I just think, what should we do as a society? Where do we go? How do we help them? Do we have interaction? Do you think that's what we should do?
Yes, and there are a good number of people who are seriously mentally ill who need permanent hospitalization. Nevada is, I can't say the only state because I haven't researched it, but most state hospitals are essentially permanent residences for people who will not get better and need the security of a 24-hour locked facility with psychiatric services, nursing, and therapies, etc. Well, Ross and Neal is our state hospital, and there is no such thing. After a couple of weeks, they'll just put them out on the street or give them a bus ticket. But in fairness, to go to New York or somewhere else, California. But every state has done that. We got caught, California got caught, but every state will do that. We'll send our problem somewhere else and let them deal with it.
Well, do we have the funds? I mean, and
of course we have the funds. Here's my solution. I don't want to get into politics now, but we don't have a state lottery or interstate lottery. And my solution is bring a state and interstate lottery, bring Powerball and Mega Millions. And if a certain industry, if the gaming industry has an objection to it and wants to keep it out, then let them pony up instead.
Help us get our streets clean up, because what do you think about this state with our services for people who are mentally ill?
The worst in the union, possibly, because we do not have a system. We have government hospitals, we have private hospitals, and then they are given a referral list, and and outpatient services are all entrepreneurial. So there is no unified system for managing people who have high needs down to people who have moderate needs.
We need a long-term residential ranch.
Yeah.
It's my dream, my thought. I'd love to do that.
The Good Medicine Ranch.
Good Medicine Ranch. I'd love to do that. And I'd want you to come with us, help us. I think you'd be great for it. However, we have a break. We're going to take a small crazy train break. We're going to do the simulator.
Good.
So that people can have some understanding. And then we're going to talk about diagnosis and what to do if you feel like you have that diagnosis or someone else in your family does. You're listening to Good Medicine. You are listening to Good Medicine. I'm Holly Davis. I am a counselor here in Las Vegas. And I want to give you my number because I want to get you some resources if you know somebody who you believe to be experiencing psychosis, hearing things, seeing things, paranoid, just conversations are delusional and they're just not making sense and they don't feel right. That's when it's time to call 702-626-9400 and I will get you the people I feel are the best to deal with that, and I believe it is a psychiatrist. What are your thoughts about that? Dr. John Nixon is my guest today.
Absolutely. You have to go to a psychiatrist. If I had a heart problem, I would go to a cardiologist. And so you have a head problem, you go to a psychiatrist.
Okay. Well, if you call me, I'll give you the ones I feel are best, and then and John can also put, Dr. Nixon can put his input on that as well, 702-626-9400. Now, if a client were to come to you, let's say a mom was going to bring a kid, and most of the times these children who come in, that their parents feel that they have something is wrong, they've experienced trauma. What are some of the other symptoms, or how would you know for sure that there would be a diagnosis there?
Well, if it is trauma based, then usually the first thing parents will see is a change in behavior, and that will be pretty clear for the parent, especially a young child comes back from childcare and something happened and no one knows what, and they don't have the videos from the security cameras, but there's a clear change in terms of the child behaviorally responding to the mother, acting out, withdrawal, those kinds of things. In terms of hallucinations, that oftentimes parents just miss it because unless the child says, "I'm hearing voices," or "Mom, did you call me?" or "Did you say something?" They thought they heard mom say something or something like that. But they will see what is called response to an internal stimuli. So they will look like they're talking to someone or looking at someone or having a conversation with someone who's not there. That's not the same as an imaginary friend in the correct, in the proper age range, or not the same as talking to yourself at all. Talking to yourself is not a precursor to psychosis, by the way.
Okay.
Yeah. So we're all safe there.
I've had some dialogue this morning.
I have to remind myself in the grocery store not to talk to myself out loud because people will think I'm the C word.
You're
crazy.
like, I was just looking for mustard, where are you? Mustard?
Yeah, exactly.
Were you, especially if you're talking to the mustard, where are you, mustard? No, that doesn't constitute. Okay. What about if you have taken drugs and you're hallucinating?
Well, there are many drugs that cause hallucinations, and some people take them because they cause hallucinations. Those would be the hallucinogens. But there are other drugs that are more of a current problem. Methamphetamine, for example, will cause hallucinations, and a lot of the so-called designer drugs that are not clearly defined what makes them up because they vary by manufacturer, things called spice and bath salts, and those things where we had like a run on zombies a couple of years ago, people walking naked in the streets trying to eat people's faces. Those kinds of drugs cause a severe psychosis. MDMA or ecstasy can cause a psychosis, and all of that can be permanent. Marijuana that's very strong can cause psychosis in people who are predisposed to schizophrenia.
Interesting. What you said was they're pretty permanent. So, for example, I have had situations where a client was perfectly well-functioning, abled, young kid, took spice, and is now batting the ceiling and the light. Yeah. And mom wanted to know if that was permanent, and I did not have an answer. What's your answer for that?
Well, there is always hope. However, it tends to be permanent. Once a person has what we call a psychotic break, it tends to stay there. It doesn't tend to go away. And just from schizophrenia, there's childhood schizophrenia is actually fairly rare. If a person has a schizophrenic break, it tends to be in young adulthood. I believe women at a little bit later shift age in that age range than men. But when it's drug-induced, it oftentimes then is permanent because it just messes up the brain and it doesn't get back to normal. And the part of the prognosis is the family history, because it does run in families. And is there a history of schizophrenia in the family?
So it could have been they had a predisposition, they took the wrong thing, wrong place at the wrong time. Then. So I do use that a lot, though. I want to tell you, when we do education, drug and alcohol education and awareness, I definitely hang that over the fire and let them know that you can take drugs that will permanently ruin your life, your brain, and could cause psychosis. And I ask them, do you want to be in a vegetative state while your family takes care of you for the rest of your life because you did something? Yeah, I take them there. Because spice and those bath salts we've seen the effects of it, and it's deplorable, and it's hard to look at the mom after that. Yeah,
because it's the components of the actual psychoactive substances in there, but it's also the other substances that are simply neurotoxic.
So what is the prognosis if you have a psychotic break? How is there anything good that can happen? Anything good that can come out of this for a caregiver who's dealing with this with their child?
Making sure that the home has stability, continuity, routine, a lack of stress and anxiety, and calm, and early interventions in psychiatry. I would not rule out alternative medicine as well, detoxing minerals and supplements and things like that. Go to a naturopathic physician, and see what might be helpful there. But get the kid in therapy, get into family therapy too, to be able to manage the symptoms and to increase or maximize the probabilities that the kid is going to have as normal a life as possible.
So continuation of care, continuation of care, continuation of care.
Yeah.
Finding a therapist that you like. If you find a therapist and you don't like them, I say next.
Yeah.
Find a therapist that you like. Also, I can't stress this enough, is if there are medications that are prescribed, take them as prescribed, and do not miss your appointments.
Yeah, this is a problem with schizophrenia and also with bipolar disorder and depression to a little bit lesser degree, is that people start to feel better. They don't like the side effects of the medications, which all tend to be on the drowsing side, because they all are major tranquilizers, the antipsychotics. And so they feel like they don't need them anymore, and then they go way out there and they end up back in the hospital and get put back on medications. And for some people, this becomes a cycle, and so it interrupts their ability to have a normal and healthy, productive life.
You can, though, and I want to say to those caregivers and even those who are listening who have experienced some of those side effects, compassion, I think, is the key. And so what we're going to do is we have a simulator. We're going to simulate what it would be like if you were experiencing psychosis on just a regular
auditory hallucinations, hearing voices.
So you wake up in the morning and you hear something like this.
You're a waste of
Why are you
space.
so stupid? Don't eat. Out to get you. They know about you. Time for meds. Don't do that. You are ungrateful.
You're a waste of space. A waste of our time.
So
Stupid.
kind of
So
hard to have a conversation with this, right?
Yeah, it is. I'm pulling off my earphones so that I can actually have a conversation with you, because it is so distracting. But what I want you to realize is that, and our listeners to understand, is that this is what schizophrenics go through when they're in the so-called active phase of schizophrenia, when they're having active auditory hallucinations. Sometimes the voices come and go, but it's hard to do anything and focus on the real world, if you will, with all this going on in your head.
Well, you did that very well, but I'm not going to cheat. I'm going to keep my headphones on and try. But I got to say it's down low. But if it was high and I have this going on and I'm trying to have a conversation and live my life, I would feel, I can't even tell you how I'd feel. I'd feel nervous, scared, like I want to run away. I want it to stop.
Confused, frustrated, wanting to act out. And in therapy, going back and looking at the content of those negative messages. Because for a lot of people who are not psychotic, they don't hear it like that, like it's actually other people physically there. But you hear them as sort of your own automatic thoughts. Where do those come from? Where did you hear those before in your life? And then therapeutically going back to not regression as such, but essentially deconstructing those voices so that they don't have, and those people don't have the power over them as adults, or the power over them in the present.
So do you think that there's a way to become empowered when you're hearing things like that? What advice do you give to clients who hear those voices?
Well, this is where the medications, clearly the antipsychotics are the most help. A lot of times you'll see seriously mentally ill people with headphones on, with earbuds on, because they're listening to music, turning it up loud to be louder than the voices. They tend to smoke a lot, cigarettes, because nicotine will help reduce the psychotic experience to a degree. But it's not that they'll smoke more and it'll go away. It's just only to a certain degree. But that's part of the reason why you'll see a lot of SMIs smoke, as well as the fact of the drowsing, the sedating effects of the antipsychotics. They're trying to compensate for that with a stimulant effect.
They're trying to sleep. I know a couple of my clients, they like to sleep. That's the only thing that they can do is sleep, and that they feel helps them a little bit. Also, I know that when family is participating and communicating and is showing compassion. That helps immensely. And for me, what I say to my clients, and I mean this from the bottom of my heart, I tell them, you know what? Especially those who are adults who've lived through this throughout their childhood, I say, you know what? To me, you're my biggest hero, because for you to be able to go through life with everything that you have going on, your courage is immense, and for you to have gotten through as much as you have, and some of them have even had children and functioned and lived and carried on. Some days it's real hard to be strong, and I say, you know what? I admire you. I couldn't do what you do, and your tenacity is amazing. That you get up every day and you just keep going and try and seeking health, and that's, I think, the goal.
And you're treating them with dignity, and you're highlighting their strengths and couching that, framing that as heroic, as courageous, because it is.
It truly is. So if you have somebody, or if you personally are going through, if you've had a psychotic break, and what that is all of a sudden you're hearing things and seeing things, and it's not just your normal, your voice talking. If you're hearing other voices, seeing things for sure, starting to feel paranoid, please call me, 702-626-9400, and I'm going to do my very best to get you the help and the resources that I believe would help immensely. And I do know that there is help available. Ignoring, avoiding, and I know for sure escaping with drugs and alcohol and not taking your medications and not getting help. That's why we see the people that we see on the streets. When we come back, we're talking to Dr. John Nixon. We're going to take a break on Good Medicine. We're going to talk about what you and I can do. Regular Joe Schmoes driving down the street, what can we do? Should we do anything? Is there something that we can do? And then what can we do on a state level, on a greater level, to help people who are going through psychosis? This is Good Medicine. You're listening to Marveling at the Madness.
Crazy, but that's how it goes.
You dance to this like this.
That looks like John Travolta, kind of different era, different.
Oh gosh, what a great
Groove.
song. I hope that you turn this song up every time you're in the car if it comes on. If you don't, and listen to the words. Try not to forget them.
I also love the big band version of this that they used for the Osbourne's reality show.
I don't watch television.
They used this song, but they did a big band kind of version, like a jazz club version of it. That's hilarious.
I need to hear it. So Dr. John Nixon is my guest today on Good Medicine, and what we're talking about is psychosis, marveling at the madness. And I use that phrase because truly in ancient times, people would just grab folks that are talking to themselves and have all kinds of interesting things that happen to them, or if they've qualified themselves as a mermaid or a tree, and they'd have them come on into the pub, and we'd have beer and listen and laugh and really not treat them well. And then there's other cultures who have insisted that they're gifted, they're talented, and they have them go and bless the crops and things like that. So now we know in our culture, and I want to say right here in Las Vegas, Nevada, they're on every single street corner, and they're disheveled, they're dirty, they're hungry, they're thirsty. For me, what do I do about it? I try to help every person that I can one-on-one as much as possible, and then that's the other reason why we have this program, Good Medicine, helping the masses as much as I can to give information and education. But for me, if I see somebody on the street and I have something, particularly water, that's been closed, a bottle, I carry bottled water, as you should in this town, or money if I have it too as well. I mean, if they have a sign that says I need help, they probably really do need help. What they do with that and how they use that is, I don't know. What's your thought about that?
Well, yeah, you cannot, especially since we have a large homeless problem here in Vegas. We do not have a residency for people who are seriously mentally ill, severely mentally ill, and the hundreds who live in the flood tunnels under the Strip. This is something that we just want to ignore the problem and look the other way. But it is real. I try to help out when I can. I will give. I don't like to give money, but it's just the easiest thing to do. But water, or if they're outside of Walgreens, I'll say, I'll go with you to McDonald's or whatever. I'll buy you whatever you want, to eat. And so, because you've got a high number, at least 30%, some estimates might as high as 40%, who are seriously mentally ill, who are schizophrenic or have other severe mental illness. And you have those who are also simply down and out chronic drug alcohol abusers.
It's interesting because I was going to ask you that percentage, of course. What is the percentage of homeless people? So you feel like it's 30% are chronically...
At least 30%. I mean, that's been some of the numbers that I've seen, yeah.
That's definitely very high. What do you think about Las Vegas Rescue Mission? I know they're not well equipped for handling severe psychosis, but I know if you're...
Well, I learned from one client they have bed bugs, but other than that, those are, kind of places of first and last resort for a lot of people. It is a place because they can get food, they have 3 meals a day, they have a bed to sleep in, they have those things. All those are temporary solutions, of course. But what we need is a system that can case manage and those who are higher functioning to live in group homes, to be able to have social connection and positive social experiences.
Long-term care is, I feel, the way to go in groups. I think would be awesome, because I think in a group therapy they can have a universality to know that I'm not the only one that experiences these symptoms. I'm not alone, and maybe I'm not as bad off, or maybe I need to really get help. There's things I'm seeing I didn't realize.
And it's not that we don't have group homes and things like that. I mean, the Southern Nevada Mental Health Campus is really very nice. There are rabbits hopping around, green grass, all that, trees, and there are group homes there on the campus. So it is, but that can accommodate only a number of people.
And that's the thing, is that there's a lot of people, human beings, who are suffering from symptoms, as you could hear if you were listening to the simulator. If you're human who is listening to the simulator, that there are people who really are suffering from severe symptoms, and they do need help.
Yeah, absolutely.
So would you say that a layman driving down the street should stop and take them and get them clothes and help them and bring them in?
That would certainly be a good Samaritan thing to do.
Do you think that they're
it's
safe?
Also, but if they want to, that's the other thing. Do they want to? I mean, there are a lot of people who've lived on the street that don't want the structure for whatever reason, and so they stay in that life.
So if you feel like that's something you should do, of course, do that. But do you think that people who are psychotic, who have psychotic symptoms at the time, do you think that they're dangerous?
It depends. Not usually. They're talking to themselves and whatnot. It depends on their level of anxiety. If they are experiencing fear, if they're in the middle of a paranoid thing, then yes, they can lash out at you.
I think the real danger is when they're using drugs and alcohol, for sure.
Absolutely. And so that's the other thing, is that the chronically mentally ill, seriously mentally ill that are on the streets, drugs and alcohol is a way of life. And so it sort of solves one problem in a sense, because it may quiet the voices. It takes them into another thing when they're intoxicated, but it ultimately on the net lowers their quality of life.
I was going to say, what do you think the percentages of people who are experiencing symptoms of psychosis who are on drugs or alcohol?
A high number, absolutely, because they're self-medicating.
Yeah, more times than not.
Yes,
they're on drugs or alcohol. And I have seen people who have a diagnosis of schizophrenia who are off of drugs and alcohol. They take their medications as prescribed, probably using alternative medications as well, and are in homes that are stable, and who have a degree in psychology.
Yeah, there you are.
So my guest today has been Dr. John Nixon. Thank you so much for coming on
Thank
Good
you.
Medicine.
It's been fun.
It has been fun. We're riding the crazy train today, and I think the key for everything that we do on Good Medicine is just be compassionate. Be compassionate to our fellow humans, and this is Good Medicine, where all good things flow on Vegas All Net Radio. I'll get in trouble for that. Vegas All Net Radio. Have a great day.